Story of a man who survives a rare speechless and motionless, catastrophic and extremely rare condition that few only survive. Locked-in syndrome. On August 5, 2013, Jose Rodriguez Junior of Aurora felt a sharp pain in his head and strange numbness on left side of his body. He didn't think much of it, and it soon went away. He went to work. Co-workers warned his symptoms could be signs of a stroke, but the 31-year-old man thought he was too young and healthy for that. The next morning, the headache was worse, and his entire left side was numb. He had suffered a stroke. Rodriguez was airlifted to Central DuPage Hospital in Winfield, where he underwent a 4-hour surgery to remove the clot causing his stroke. He was not only paralyzed, but his brain could no longer regulate his body temperature. He became so overheated that sweat pooled in his eye sockets. He was packed in ice with fans blowing on him. He was in a coma for about 12 days. When he awoke, Rodriguez knew what was going on around him, but could not communicate. He was unable to move anything except for his eyes. He communicated using eye movements to answer simple yes or no questions. Rodriguez went into locked-in syndrome, which left him unable to do anything voluntarily aside from move his eyes. He felt trapped inside his body. Locked-in syndrome essentially turns its victims into prisoners inside their own bodies. They cannot move, speak or breathe on their own, but cognitive function is typically not affected. Rodriguez required feeding and breathing tubes. He still had feeling in his body. The extremely rare condition of locked-in syndrome occurs when the brain stem is disabled and can no longer relay signals for functions like movement, breathing and heart rate. The syndrome can develop from a stroke, tumor, injury or from ALS, also known as Lou Gehrig's disease. French journalist Jean-Dominique Bauby described the condition in his 1997 memoir The Diving Bell and the Butterfly, later made into a film. Rodriguez went through therapy to regain as much movement as he could. When he left the hospital, he could open his mouth again. He can now breathe on his own and move his right hand enough to brush his teeth and type on a laptop, one key at a time. He also uses the Tobii eye tracking software to write emails and a series of fantasy novels he is working on. After years of therapy, Rodriguez can even stand and walk short distances on his own, though he still primarily navigates using a wheelchair. Last but not least, he can even say a few words again. Most people with locked-in syndrome don't regain movement. In one study of 14 patients, about 20% recovered some movement, about 30% regained some verbal communication and about half were weaned off a ventilator. Rodriguez's experience reflects a movement in stroke treatment toward therapy that promotes new connections and functions between nerve cells, called neuroplasticity. According to Edward Taub, professor of psychology at University of Alabama, Birmingham, Rodriguez's recovery appears to be a good example of neuroplasticity at work. The brain was previously thought to have little ability to regenerate. Recent research has suggested that exercise and movement can promote healing. Use of constraint-induced therapy, in which patients use incapacitated limbs to repeat tasks like moving checkers to build up fine motor skills. The idea is to get the body moving, and the brain follows. The aim is to increase the difficulty of the tasks slowly so the patient keeps striving to improve. Through repetitive motions, and more intensive therapy, the brain grows new connections to rewire itself. The heart of it is, use it or lose it. If you use it, it will keep improving. Like some other stroke patients, it was also very hard for Rodriguez to control his emotions. Sometimes he would laugh uncontrollably at inappropriate times, and worried that people thought he was laughing at them. Slowly, he began to recover a lot of movement in his right arm and leg, but not on his left side. Therapists used robotic exoskeletons to move his left arm and to help him walk. The exoskeleton provided all the motion to start with, then less and less as he learned to move using his own power. That's crucial to relearning movement, because to rewire neurons, The brain has to will a movement and then learn from trial and error, like a toddler, rather than just letting the body move passively. Rodriguez's recovery was a testament to his youth and health, his motivation to get better and his family's support. For locked-in patients who don't show such strides, researchers are trying to find other ways. Ongoing studies are looking into whether brain-computer interfaces can help patients communicate. One study out of the Netherlands claims to be the first to test whether a device implanted in the brain can read activity directly in the brain and convert it to a digital switch, initially to answer yes or no questions, and eventually for other commands. Rodriguez had written fiction for years as a hobby before his stroke, and has continued writing a series of science fiction and fantasy books called The Guardians of Rhea, in which monsters are reimagined as races that must join together to fight evil. I can't tell you how many times I thought about giving up or being better off dead, but I found the strength to move on, he wrote. Whatever you do, don't ever give up. There is always hope. Thank you.